Honourable Member for Esquimalt-Juan-de-Fuca.
Thank you very much, Mr. Speaker, and I compliment the member for introducing this motion. As a physician, it is a breath of fresh air to finally have health care to be heard in this House. And I remember working in the emergency department, Mr. Speaker, and having to treat patients in the ER on the side of the hallway. I remember having to transfer patients, air evacuate them out from the town I was working in, just because we didn't have a healthcare worker, a technologist, that could do the CT scan on that person to identify potential problems. Mr. Speaker, our Canadian society is in the process of slamming into a brick wall. We're slamming into a brick wall in healthcare because of the resources that we have to pay for what we ask for and what we need are not there. And as time passes, as our population ages, then what we're having is that gap between the supply of resources and the demands that we have on our healthcare is simply going to widen. What's happening is that those who are least able to afford it are falling through the cracks. They're the ones who are being hurt by inaction. They're the ones who are going to be hurt if all we do is talk about things and if we don't fail to act. We understand full well that the responsibility for health care rests is in the purview of the provinces. But nothing prevents the federal government from using its convening powers to work with work with provinces that want to work with us to get things done that we need to have. The fact of the matter is that we are constrained by a Canada Health Act that was good in its time but needs to be modernized. It can't function and do what needs to be done, and our province cannot do what they need to do if we are going to be constrained by the situation we have today. If we look at the top 20 healthcare systems in the world, 17 of those healthcare systems are where? They're in Europe. So this ridiculous discussion that we have, if it's not ours, it must be the U.S., is a nonsensical debate. Because the real debate that we should be seeking out, and the answers we should be pursuing, is who's got the best healthcare systems. And what we need to do is just to peer out towards Europe, and we'll find that 17 of the 20 best healthcare systems in the world are there. So what are their characteristics? The member quite rightly and wisely put technological development in one of her 3 requirements. If you look at Europe, they use IT tools much more effectively than we do. And we absolutely have to be able to use IT tools to reduce duplication, reduce waste, and improve efficiencies in the system. It is ludicrous that we are so far behind the times. The second point in this area is that Canadians might need to know that while we discover all these remarkable things in medicine, the Canadians have access to this in a limited way. And the reason for this is that provincial governments have to withhold or ration care, and they can't afford to provide the best care that's available. So the scientific discoveries we're having are not available to the Canadian public because governments don't have the money to pay for them. So there's this gap, and Canada ranks somewhere in the 20th to 25th in terms of Canadian citizens' access to new technologies. On the second part of healthcare professionals, and the member was again right to put this on, is that we desperately need a national healthcare workforce strategy. As we get older, our healthcare professionals are getting older. The average age of a nurse is about 42. The average age in some specialties in medicine, my profession, as a physician in my profession, is somewhere in the 50s. You can't train a doctor in 4 years. It takes 12 years or more to be able to train a certain type of specialist. You can't easily reproduce them. We desperately need this strategy that needs to be implemented with the provinces, not only for physicians, not only for nurses, but also the technicians and other healthcare professionals that are part of our team that enables us to serve the public we treat. In the third area of healthy living and prevention, I was privileged to attend the last week the big Pediatric Academic Sciences Conference in Vancouver, the largest of its kind in the world. 6,000 of the top pediatric scientists in the world were there. And one of the big issues that was spoken about is as the honourable member mentioned, is the epidemic of childhood obesity. Dr. Tremblay from Montreal did a phenomenal study comparing Canadians from 1981 to today, and what he found was shocking in its results. He found that from 1981 to today, the level of obesity has increased dramatically. Fitness levels have plummeted. Part of the reason is that the average Canadian child, imagine this, the average Canadian child watches how much television in a week? 40 hours of television per week the average Canadian child watches, or they're in front of a screen playing video games. This is ridiculous. We weren't designed to do this. So as a result, we're seeing chronic diseases that are now shifting lower and earlier in the demographics. So younger people are having higher incidence of type 2 diabetes and cardiovascular problems. The result of this is putting a huge and increasing burden on our healthcare system, and that in combination with our aging population is essentially going to break the back of our healthcare system unless we act, and act quickly. One of the motions I introduced recently is very simple. Why don't we all advocate for parents to turn off the television set and turn off the video games one night per week, just one night a week. Get kids out and active. If they're out and active, engaging in free play, they will be able to dramatically change not only their physical abilities, but also their mental abilities. Because what we found and what we can do now is we can actually peer into the developing child's brain. What we know, Mr. Speaker, is in the prenatal stage to the first 5 years of life, you have the most dramatic impact upon the trajectory of that child into adulthood. Subject a child to a loving, caring environment with proper nutrition, where they are subjected to being read to and actually reading books later on. What happens is the connections in the brain actually happen well. Conversely, subject a child to violence and sexual abuse, where they're witnessing drug abuse and violence, give them poor diets, and the neural connections that take place happen very poorly. As a result of that, because the frontal cortex and the lower parts of the brain are not connected well, we see a much higher incidence of drug use, juvenile crime, poor outcomes in school, less dependence on welfare, and poor social and economic outcomes. So it's essential, Mr. Speaker, that what we do in the first 5 years of life has a dramatic effect on the trajectory of that child. And if the government wants to really do something in terms of reducing crime, for heaven's sakes, work with the provinces to enable them to be able to have an early learning program for parents and children. In the prenatal stage for the parents and in the first 5 years of life. If you do that, you will have a dramatic and profound impact upon the life of those children. Kids need free play. The other thing we can advocate in the public health aspect is just take kids to the library. Drop them off at the library, leave them there for an hour, let them roam the books, let them use their imagination. Because if you do that, then they'll have a chance to read. And we know that literacy is one of the most powerful ways in which you can improve the trajectory of that child later on in life. These are simple things, Mr. Speaker. Inexpensive, easy to do. Also, kids who are plugged into TV sets and in video games, they're not engaging in learning, having the imagination and the social skills that they need to be able to have in order to function well as adults. So that kind of free play and socialization may sound subtle in many ways, but it has to be done, because those are the subtle interactions that take place that enable the neural connections and enable that child to be able to move forward and to acquire the skill sets they need later on. Lastly, Mr. Speaker, I just want to say that, to summarize, if we're going to enable us to have a healthcare system that serves the public later on, then, which we must have, we have to work with the provinces, like-minded provinces. We have to modernize the Canada Health Act. We have to bury our ideology. We have to pursue the facts, pursue the science. The solutions are out there, and we have to implement them. Talking is not going to save anybody's life. Only action will. Secondly, we have to have the national workforce strategy that we have to implement with the provinces. And again, let's make sure that we look at the solutions that work. Let's look at Europe. Why does Europe have 17 of the top 20 systems? Look at their funding models. Look at how they enable the governments and the private sector to work together. Let's look at how they treat their healthcare workers. Let's look at how they acquire and retain healthcare workers. What do they do in terms of prevention? That package of solutions, Mr. Speaker, will enable us to be able to make sure that our citizens, when they get sick, they will have a healthcare system that will be there to treat them and treat them well. Thank you.
Reprise de débat.